describe the product offerings that you have at MDR?
Sure. So, from the very beginning of the chronic care management codes, we were one of the first companies that offered that. We've offered that as RevUp, which is the remote care program. It's an add-on service that practices make available for their patients. What that means from a delivery standpoint is we really work closely with the medical practice and the provider to work as an extension of that practice, where our clinical teams work to establish the protocols, reach out to the patient, follow those protocols, really be all of the external touch points that keep a patient engaged from the initial enrollment point of the program through month over month of an evolution of conversations and activities, but always centered around that care plan. And so really do that in a way that we are able to support the patient, handle 80 to 90% of all of the interactions, and bring the practice and the provider back in at the points where they're needed to really support the patient and connect them back to the practice for a change in medication or a follow-up visit. But really let them quickly add these programs at a scale that they couldn't without a partner to help them, and really let their office staff focus on the visits at hand and the work that they have to do, and know that they have a trusted partner to be doing that outreach and helping their patients and guiding them in a much more high touch kind of remote fashion in between those appointments.
So that is RevUp, and that is a full service program where you utilize clinical care teams that you guys have ready to help the clinicians.